Hi guys, my name is Molly Roberts. I'm a current student at Big Sandy Community and Technical College, and I'm in the dental hygiene program. And today I'm just going to talk to you guys a little bit about toothbrushing, flossing, some different kind of mouthwashes, just some different little tips and stuff to get you all in a better oral health status. So I know that this presentation might seem like it's going to be a little bit kiddish, a little bit juvenile for your age group, but toothbrushing is really important, and we only know what we've been taught as we've been raised, and sometimes things change and you just might not know that there's some different options, different techniques, and different things to really help you just have a much better and much healthier oral health status. So first I want to talk to you guys about the importance of brushing. So why is toothbrushing so important? Well, there are lots of bacteria that live within the oral cavity. So anytime that you are eating and drinking things, the bacteria and stuff just really rely on all those foods, sugars, and everything to thrive within the oral cavity. So these bacteria are constantly multiplying and constantly just trying to get onto those tooth surfaces and below the gum lines and in between, and just really create a nice cozy little place for them to reside. So your oral cavity is constantly creating a film. It's called the biofilm that stays on the surface of the teeth. So without removing that, you are just allowing that bacteria to build and build and build. So this is what leads to plaque, which is the soft kind of, we call it cottage cheese looking stuff that can form on the surfaces of those teeth. It also leads to calculus and tartar, which become hard and stiff. So that plaque gets to a whole new level, a different stage, and it becomes really, really difficult to get off, which is when you get to come to the dentist and we get to use our little tools and get all that off there for you. Because toothbrushing, by the time it gets to the calculus phase, will not remove all of that off your teeth. So this just promotes health on your teeth, and then it also promotes your tissue health. So all of your gums will be a lot healthier if you're brushing correctly. This also is going to prevent cavities from forming, which are very bad if allowed to continue and grow. They can cause a lot of pain. They cause your teeth to rot out, as most people would call it. And we just don't want to do that. We want to make sure that you're preserving your natural tooth for as long as you can, because these are the teeth that you're going to rely on for the rest of your life. So we need to make sure that they're really being cared for properly, because they're very important. So I want to talk about some of the techniques that we use to brush our teeth. So a lot of people think that the harder, more aggressive that you're brushing, the more effective brushing, but that's not the case. So your teeth are down in the gums, which is the very sensitive kind of tissue. So the harder that you're brushing, the more damage you're actually causing to those tissues, which is going to lead to the tissue kind of receding back off of the tooth, which is going to lead to sensitivity. You're going to be more prone to getting cavities, and it's just going to cause you some issues down the road. Aggressive brushing like that, some people you'll see that have like almost little triangular shaped areas like notches right beside the gums on the very tops of their teeth, and that's going to be because of too aggressive brushing. And this can just, like I said, lead to sensitivity. That surface of your tooth, once you get past that top layer on your tooth, is going to be a lot easier for those bacteria to get into. It's a little bit softer, and it's going to cause bigger cavities. So you want to make sure that when you're at the store picking out a toothbrush, that you want to find one that is a soft bristle. So a soft bristle is going to do less damage to those tissues, but it's still going to clean effectively. A lot of companies like to promote their hard tissue or hard bristle toothbrush, but you don't want to use these because that's going to cause the damage. You also want to make sure that when you're brushing your teeth, you have your toothbrush at a 45-degree angle. So this is going to allow those bristles to get up under the gum line, as well as take care of all of the film that is on the surface of the teeth. So you want to use that in a 45-degree angle and in a circular motion. So you want to do small circles all the way around with that angle kind of upwards towards the gum line, 45 degrees. That way you're making sure you're removing all of that biofilm, all those bacteria from the surface and just below the gum line. So each quadrant, which is from the back tooth all the way to the midline, you have 4 of those. So there's 1, 2, 3, and 4. You want to make sure that you're brushing for 30 seconds in each quadrant. So this is going to give you plenty of time to get on the outside and then as well on the inside. This will be a total of 2 minutes. And I know that 2 minutes seems a lot. You know, we're busy. We have all kinds of schoolwork to do. You know, we have things that we like to enjoy, extracurricular activities, whatever. So 2 minutes kind of sounds like a lot of time. But when you're thinking about your overall oral health and how that's going to contribute to you keeping these teeth healthy and keeping them without cavities, it's really not that long. So you want to make sure that you're doing that 2 minutes a day, one at least in the morning and certainly before you go to bed, because you don't want all this bacteria staying on your teeth while you're asleep, because that's typically, for the average person, around 8 hours for those bacteria just to stay and multiply and really get cozy there on the surfaces of your teeth. So then, along with your toothbrushing, we also want to make sure that you're using floss. So with floss, you want to pull out a piece that's about the length of your forearm. And when you get your floss out, you're going to wrap it around your fingers like this. And then you're going to put those around your teeth in a C kind of shape. That way, when you go down in between the teeth, if you go straight down, you're going to damage the tissue right in between, and we don't want to do that. So you want to make sure that it's at a C shape because your teeth have a curvature to them. So that's going to wrap around the tooth easier, and it's going to cause less damage to those tissues in between. So you want to go down, create that C, kind of create an up and down motion, and make sure you're getting all of that debris and bacteria out from in between the teeth. Those in-between spaces is a really great place for these bacteria to harbor. It causes lots of cavities, and you can't see those spaces very well. So even when you come to the dental office, they're going to have to take x-rays to see those areas and make sure that there's not cavities already growing in those areas. So we just want to make sure that you're really taking good care of them by flossing. There's all kinds of different floss. This is just a regular waxed floss, but they make unwaxed, they make really thick. The little floss threaders are great. For anyone that has braces, and some of you may have or currently do, you know, you want to make sure that you're really getting under those wires and in between, because that is a really, really vulnerable time for those bacteria to really get in those spaces, because it's a lot harder to get to those areas. So if you combine the correct toothbrushing techniques and flossing, you're going to limit that bacteria count a lot. So to go along with your brushing and flossing, you know, a lot of people really like adding mouth rinse to their daily routine. I personally really love Listerine. It just does the trick for me. It makes me feel like I have a lot cleaner mouth. The mouthwashes are designed to eliminate the bacteria. So that's going to get bacteria off the surface of your tongue, in between your teeth, on your teeth. It's just going to really take that bacterial count down to a much lower number. The only thing that you have to watch for is that some mouth rinse brands do not actually have the correct active ingredients to eliminate bacteria. So when you're picking out your mouthwash, make sure you look at the ingredients, because some of them are just going to offer a limited amount of breath enhancement, and they're not actually going to kill any of the bacteria. I know that Scope is one of those brands. They promote better smelling breath and this and that, but it doesn't actually eliminate any bacteria. So brands like Listerine, Colgate, Crest, and Act all have those active ingredients that are actually going to take that bacterial count way down. So just make sure that you're choosing the correct one. Most mouthwashes also have alcohol content, just a very small amount, but that's what creates the burning sensation. So if you are one of these people that really do not like how the mouthwash, makes your mouth burn while you're using it or soon after, you can actually get alcohol free. This does not cause the bacteria count to be any less effective, but it does at least eliminate the burning. So there are plenty. I know Listerine has an alcohol-free. I think the Crest and Colgate do as well. So just pick things that are, fit your personal preference, and whatever works for you will help you create a much more effective oral health status. So I hope this presentation hasn't been too juvenile for you guys. I hope it's been helpful and that you got some tips that you might not have known. I have also attached just a small personal questionnaire. It's like 3 questions, I think, just for you to self-evaluate how well you brush and if you can make any improvements. So I hope you guys are doing well, and hope that this helps get you to a better oral health status. Thanks.